So we received the agenda for the session, but just to go, I may not need to go through the agenda, but just to welcome you and say thank you for sparing time to be on this session. And all of you are welcome. I see quite a number of people who have already come. People from ASLM headquarters, you're welcome. Just wave to us. People from ASLM headquarters, Pasco, you're welcome. Asaf, Kouma, Legese, Lillian, Martin, Mike, Miriam, Miriam Lapkin, Nancy, Ndrovu, all of you are welcome. We may not be able to go through all of us introducing ourselves, but we request you to register yourselves. The Tanzanian team, you're welcome. Nicholas, somebody XKA9, all of you are welcome, but please use the chat function to register your presence. Give us details that are going to help us to know who was on this call. So in terms, this is our second session. The last one we had was on the 24th of Jan. Now this is our second one. And today's session, we decided to make a recap of the sample transport, but today concentrating on the hub and spoke. The hub and spoke function in terms of supporting the sample transport network, as well as supporting the lab system strengthening. And we are going to have 3 countries presenting their experience. But before that, I would ask Legese in about 2 minutes, just to take us through what do we need to do while we are on Zoom. Legese from headquarters.
Thank you, Charles.
Okay.
Can you hear me, Charles?
Yeah. We hear you.
Yeah, thank you. And welcome all of you to the second LabCoP ECHO session, which will start in less than 5 minutes, the actual presentation. I would like to talk a little bit about some helpful tips about on how to use Zoom during those sessions. Next slide, please. So for educational and quality improvement purpose, I would like to kindly let you know that we are recording this session. So if you have any problem with this regard, please let me know. Use these 2 email addresses, and you can chat me if you have any reservation with that. So some helpful tips on how to use the Zoom. The first thing I would like to tell all of you is please kindly mute all of your mics so that we will not have any disturbance during the session. And also make sure that you place the webcam, be it the external camera or the inbuilt webcam, put adequate, put properly so that we can see all of you, very visibly. Another thing I would like to let you know is the use of the chat function. Whenever you have any questions, be it to the facilitator, that's Charles, or to the coordinator, the ASLM headquarters, please use the chat function. And you can find the chat function below the status bar of your screen. So don't forget to use the chat function. And also, please let us know the list of participants from your side. Let us know the names and email address of the participants from your side, and you can chat to us. Another very important thing I would like to tell you is whenever you have any questions, please raise your hands so that Charles, the facilitator, and the ASLM headquarters team can see you and give you the chance to forward your questions. or alternatively, you can use the chat function to forward whatever question you have. So these are the very important tips I would like to forward to you while using the Zoom link. Thank you, and I'm looking forward to an interactive session and fruitful discussion. Thanks. Charles?
Okay, Legacy, thank you very much for taking us through the tips. That I think will help us run this session smoothly. Now we want to have our first presentation from Kenya to be presented by Nancy Bowen. I ask Nicholas to flash the slides, to share the slides for Nancy. Nancy, you have 12 minutes to make this, to go through the presentation.
Okay, good afternoon, all of you.
Widen the slides, make a full screen.
So good afternoon, all of you.
Yes, please, you're welcome.
Yes,
good afternoon.
on behalf of the lab team, I will present on the hub and spoke model for supporting sample transports supported system. Most of my team.
Hello. Hey. You have been okay. Hello.
Yes.
Okay, please go on.
Are you able to hear me?
Yeah, yes, we are hearing you.
Okay. So I'm saying on behalf of other teams who are not in, I will present on the hub and spoke model within Kenya laboratory system. It's sample referral. Next slide, please. So the background of sample transportation in Kenya is that we have about 4,000 facilities who are currently referring samples through networking in the high burden HIV facilities and medium burden. And mostly I'm referring to the viral load and EID testing. Here we have currently centralized sites, 8 facilities in country. And the mean of transport is, we have mixed models. Use of national courier systems to the sites which you can high burden. Motor riders also from facilities which cannot reach the courier services, and county partner contracted couriers. And the sample type we receive is normally plasma and DBS. DBS for hard to reach areas and where plasma cannot be visible, and also the cold chain cannot be visible there. Next slide, please.
Next slide.
So this is the country map, the way that we network samples. In terms of at the right side is the testing facilities for viral load and EID, and the way they are shaded is where the samples are referred to that facility. So you can see one of the sites are supporting hard to reach areas where it's dark green, the first one, and that is how we mapped our sites. Next slide. This is a GIS mapping of network in Kenya. So you can see where the testing viral load sites are concentrated into high burden areas. And you can see most of the first area, we are still missing some facilities, testing lab. So our movement is to work toward decentralization. And that's how you can see how far the samples can come to the testing facilities. Next. So this is our national hub model of operations on how we disperse samples. And mostly the facilities, the way I've said, they are mixed model. The sites which are nearer to the testing facilities can take their samples directly. From the spot, batch for them and receive and then transport directly again to the testing facility. They separate for the samples and samples can be sent to the facility. Next, please. So this is So this is the model of how they refer. Utilization of partner support referral hub. We use partners in another model. We use riders to facilities which are closer to the testing lab, and high volume sites we access using the courier because of where the vicinity of the courier services are, and utilization of national contracted courier. Next, please. So the criteria we use for select these hubs is based on the capacity of a lab to be able to support cold chain, which have power stability. Yet they're able to centrifuge because they centrifuge samples on behalf of the facilities which doesn't have capacity. Human resource capacity is again what we look at in terms of sample management. Is this facility located? Is it a centralized place or accessible? What is the workload? We look at the workload again, potentiality of facility to benefit the network so that we can network some facilities to this hub. And again, the capacity of that hub to be able to do other ART-related analyses, like hematology, CD4, and chemistry. Next slide. So the benefit of what does these hubs does for the other facilities or the spoke facilities, they are able to separate plasma samples from whole blood in terms of viral load. They are able again to spot for facilities in terms of EID and in case of HIV drug resistant test. They have capacity to have chain, so they keep the samples in a storage place before they are transported. They can also offer cool boxes to facilities which are not able, the spoke facilities. They have standardized sample packaging. Sample remote logging is able to be done in these hubs where samples are logged in from the hub to the testing facility, and the results can be channeled back to the hub, and then they can give results back to the facility on their behalf. They have capacities of sample management processes and reject. They can also support in the rejection interventions to facilities which they send samples to them. And they have a rationalization sample referral and updating GIS, as I had shown you in the Kenya map on how we do the mapping. I think this is a repetition of what they normally do for as a hub. What are they able to support again? Other related tests on HIV in terms of gene experts for TB. They can support lower facilities. They can do CD4 for them. They can do confirmation for malaria, crack antigen tests, pregnancy tests, and hematology and biochemistry tests. And how the results are channeled back is some of them can use for TB is the web, the CLIMS system, and other facilities can pick the hard copy through the partner support or disseminated, or they come for them. Next. So the experience in terms of how the courier can complement the hub system is that the national courier system are designated to decongest the hubs. In terms of when the hubs receive this, the courier system supports the transportation of that sample from the hub to the testing facility. The primary function again is to cover sites outside courier operation perimeters to enhance uptake and coverage. Hubs will also package samples and provide cold chain where needed be. Hubs with proximity to the testing lab can utilize riders as cost-effective measures to collect separate. Because if you send each and every sample through courier, it can be expensive. But if you can batch them and receive in a hub, the utilization of reducing cost using riders is helpful. Hubs utilizes the best fits of transport within the locality again. Next slide. Next, please. So this is how the way it's up to the hub. The samples can be logged in to at the hub, so that if they do remote logging, all the samples go to the testing lab, and the results can be sent back to the hub, and they can channel back through the web back to the facility, or the facility which sends the samples to the hub. Another channel is through we have a dashboard system, EID viral dashboard system, so people can receive their results again through the website. We have utilization of the SMS printers or SMS notification to the patients, where if a viral loads are above 1,000, they can be flagged through SMSs, and they are told to go back to collect their the results back. They're notified that go back to the facility to be given interventions, or if they are suppressed, they get a notification of congratulations that your viral load is suppressed. So we have the 3 mode of relay of results, and that reduces the turnaround time and logging. Next, please. Next slide. So what is the strength so far we see using utilization of hub utilization is that it improves sample management practices within the referral chain. Hubs takes up responsibilities on pre-analytic sample quality, because if they can look at the rejection before they reach the testing lab, so they can improve that. It has also improved access and coverage to the testing facilities where the other services cannot be reached. Next. I wanted to look at first the next slide before I come to limitation. Next slide please. The lesson learned so far. Despite the wide coverage and scale up of services, innovative investment needs to be made to sample referral services. In that, it reduced turnaround time to facilitate treatment coverage. It also contributes to reduce loss of follow-up, and also to improve referral data completeness, timely and accuracy. It standardized referral packaging commodities, to frequently update GIS data so that we can decongest. If another hub gets more samples or sample being referred them, we can decongest it if you do mapping, and improve on data management and tools to capture all quality indicators in the referral chain in terms of TAT, specimen referral, rejection, workload, and completeness of forms. I can take back to you to the limitations so far. Previous slides. So the limitation is that there is lack of standardization of commodities in collecting samples. Where these hubs are dependent on partners, different partners give different packages. Some only can support the transportation, others will not support supplies which are used to collect these samples. So there need to be standardization on that. And we need to review that guidelines to support remote logging, web-based results, among other innovative practices, and lack of standardized partner support, as I said. I think that is the last. Go next slide. Next.
Okay.
So I want to acknowledge the Kenyan team who contributed through the contribution to all ways they have used. And on behalf of that, I say thank you.
Okay, Nancy, thank you very much on behalf of the Kenyan team for that very elaborate and interesting synopsis of the Kenyan hub and spoke experience. So I will ask Nicholas to bring in slides for Malawi. I hope the Malawi team is James. Is James ready? Hello, James. Hello, is James on? James? Okay. So let us, if James is not yet on, let us do the Tanzanian slides. I think the Tanzanian team is ready. Mr. Kabuje, are you ready? Flash the Tanzanian slides. So we will ask questions at the end. Please note your questions, and then we will ask the questions at the end. So I ask the one presenting on behalf of the Tanzanian team to take the floor now.
Hello.
Hello.
Oh, can you hear me?
Very well.
All right, thank you. My name is Joseph Mzirai, and I will be presenting the hub and spoke picture for Tanzania. Mr. Kabuje is still trying to connect with the system. He's not in the same room with us. Okay. Maybe he will participate with us during question and answers. All right. Okay. Please next slide, please. So currently, Tanzania, due to in the process of scaling up viral load testing, we had to introduce the hub system in order to reduce the challenges of facilities transporting samples to the testing sites. So we did a mapping exercise where we introduced around 309 hubs, and so far around 57 hubs have already started the piloting in sample transportation, and most of these hubs can be district or a laboratory, which because of its geographical position and the logistical issues, it can be an ideal site to be used as a hub. And then these hubs were capacitized in order to be able to perform those functions as a hub. And in the matter of reducing the issues of sample transportation and the data entry, we also introduced another system. This is an electronic system called SRS. It's a sample tracking system. We have already installed it in 57 hubs. Well, basically what this system does is in the hub area, they review all the samples and do the registrations. So when the sample arrive at the testing labs, we don't do any more registration because all the data is already available in the national repository. So what the testing laboratory only just pulls the information from the repository and use that information for testing. So 57 hubs have already been installed with this system, and around 100 we're expecting to extend to 104 in a few weeks or a month. Next slide. This is a simple map showing us exactly what our hub system looks like. If you look there is health facility level. In the middle, we have the hub. And at the end, on the right side, you have the zonal laboratory. So the samples, this shows the flow work of samples from the health facilities to the hub. We usually use, if you see the lower lines, we usually use motorbikes or any other systems which can be used in the hard to reach areas. And from the hub areas to the zonal labs, different system can be applied, maybe a vehicle or courier. Maybe sometimes these vehicles are supported by implementing partners. For those facilities which are close to the testing labs, they can follow the red line at the top, where every sample is transported directly to the zonal laboratory for processing. Next slide. Oh, so these are the current practices, as I explained before. The flow of the samples. The samples are collected in primary collection sites, and then within a period of, if those facilities are not capable of storage and centrifugation, within a period of 5 hours, they're supposed to be transferred to the hubs. From there, where they're processed into plasma and then stored in the freezer. And then this is one of the practices which we experience in the Southern Suns. The implementing partner decided to use the cars which are installed with freezers. So they go to the hubs with these cars and then pick up the samples from the hubs and transport them to the testing sites. In another area like Dar es Salaam, we're having a different application of transportation system. Dar es Salaam is testing its own samples. We're not currently receiving samples from other regions. So we try to cover only facilities within our region. Mostly we use bikes. So since it's just one region, we select few sites and attach one bike, which passes there twice every day to pick up samples and send them to the testing laboratory for processing. So you can see where there is a sample collection which is done from morning to 10, and then a bike from 10 to 11, then a bike passes through, picks up the samples. And then they're gonna come back again around 15 hours PM to pick another set of samples. Another system which is also being practiced by using peer educators. These ones, they're using public transport, and they usually transport samples using call boxes, and they carry them all the way from the hub to the testing facility. Another slide, please. Next slide. All right, the criteria which we've been used are more or less like this, the ones that have been used by other countries. We consider geographical location of a facility, uses a facility which can easily be reached by transportation system, and we consider the radio coverage of that laboratory. If it covers many laboratories in different directions, then it can be used as a hub. And also infrastructure of the laboratory. Does it have a capacity to do it? What's the difference between that laboratory and other laboratories? Is it easy to capacitate if there are funds to capacitate? So because other facilities, the labs are too small, you cannot say you can just capacitize it to be able to function as a hub. So the facility infrastructure is also a considered factor. Next slide. So how does the hub have helped us? What has been the significance of this hub system? The biggest thing it has helped us is in maintaining stability of samples. Many facilities have a small capacity to manage sample collection and maintain its credibility for viral load testing. So the hub system has created.
You have 1 minute to go.
Okay, the hub system has created a system where sample stability can be managed, and also has reduced the rejection rate where the samples are the facilities with hubs are capable of following up the health facility for samples which have challenges, and so they will not reach to the laboratory where they will be just wasted. So all the issues are solved at the ground level. It minimizes the costs, especially if in transportation, all the facilities should transport samples to the testing laboratory. It will be a long distance and a lot of costs will be used. And also by results transportation back by using SRS, results are coming back to the hubs by using email, and then they print them and send them back to the facility, which is shorter distance compared from the testing lab to the facility. Next slide. Next. Also, challenges we're facing are the same ones which will be used for criteria. No, can you go back to the, thank you. The power cut, poor roads, staff turnover, financial problems to capacitate all the laboratories to be hubs, and donor dependency. These are issues, we're looking at issues of sustainability of these systems. Lesson learned, it is possible to integrate this model with other samples, and use of sample tracking system to enable electronic results transfer back to the hubs. Thank you.
Okay, please, thank you very much, the Tanzanian team. That was very exciting, very interesting. Now I wonder whether the Malawi team is now ready. Are we having the Malawi team online? Is James on? I think the Malawi team is still having some challenges. James, are you on? So it looks like we may miss out the Malawi presentation, but that opens up more room for discussion. But I can pick a few things that I learned out of the Malawi presentation. Only that they needed to be there to answer the questions. Okay, so that's very, very interesting. We salute the countries that have presented. And if the members don't mind, you can clap. Okay, we salute you and we thank you for using your lessons to teach all of us that it is possible to have a sample transport system that eventually enables increases access to services. And of course, the reason why we picked on this particular topic is because we do not want only to talk about HIV or viral load, but we want to start building a system that eventually supports the entire health services, the laboratory system strengthening. So that hub and spoke can be used to do other tests. We have seen from the Kenyan experience, they are also doing CD4. I mean, they are doing CBC, they are doing chemistry, they are doing all other tests at the hub. And probably Tanzania will also tell us how their hubs are supporting the wider scope of laboratory services beyond HIV viral load. So now I open the floor to responses, to reactions to the presentations that have been made. So you put up your hand. The headquarter team is observing, is the one to clear you to start making your submissions. Yeah, if you want, you put up your hand and they unmute you. You can also unmute yourself. We need to react to the presentations that have been made. So it's now moment for us to react by posing a question, clarification, or adding something and so on. Okay, so the members are not wanting to ask questions.
Yes. Hello.
Okay, please.
This is Martin.
Martin, okay.
Martin from Uganda. Yeah.
Good.
Uganda.
Okay.
Yeah, I wanted the presenter from Tanzania to throw more light on sample tracking right from the health facility, tracking of the results, until the last arm of the cascade, where patients receive the results and they're managed according to the guidelines. Hello?
Okay. So the Tanzanian team, you want more clarity on how they use the tracking system to actually fall through until results get to the patient. Okay? Maybe on top also of the same, I would also want to know for the Tanzanian team to tell us the laboratory information. Hello?
Hello?
Yes, your
second one
has been taken. You have another one, okay?
Yes. I also wanted more light on how the clinicians at the facility send the the SMS to get results from the testing lab.
Okay. So the Tanzanian team, we may get a few questions before we respond. Tanzanian team, you need to respond to the question of how the tracking system is used to relay information about samples and also transmit results. And then the use of SMS to communicate results to the doctors, and whether that does not impinge on people's confidentiality rights, and whether it doesn't pose any challenges. But also even to tell us the information management system, the laboratory information management system that you are using. Is it homemade? Is it a generic one? What is it that enables you that a sample entry is done at the hub and all the information is found at the site and the delay of results? Is there any other reaction before I call in the Tanzanian team to respond? Any other questions?
Yeah, I have a question.
Okay.
That's Pascal from ASLM. So I wanted to ask the two teams, Kenya and Tanzania, whether they have also thought of ways to use the hubs in order to provide maybe supervision for the laboratories that are connected to them as spokes, because we know it's very difficult for the Directorate of Laboratory of the National Public Health Lab to provide supervision or mentoring for the quality. And is it possible that those hubs should be used in order to help the facilities at the lower level? That's my question.
Okay, good. Another question?
Yes, I have a question from.
Okay, like this, yes. Hello?
Can you hear me? Can you hear me?
Yes, we hear you. Country teams note the questions.
Okay, my question goes to both the presenters. I would like to hear the experience of having a focal person at the healthcare facility and at the hub or spoke sites to facilitate or coordinate the sample transportation system. Thank you.
Okay. I could also ask about the coordination, because I found the Kenyan system has got many permutations, many ways to do it. And then a couple of testing labs where you have the bike riders, you have the courier, you have the partners, and then the many testing labs, how all that is coordinated. How do you manage the coordination of all the players and ensuring that samples don't get lost or don't end up in the wrong place? And then the Tanzanian team, you talked about part of your permutation is where health workers move to take samples to the lab or to the hub. How does that impact service delivery? Because eventually, if you're going to get your lab tech, the only one or two to leave the facility to carry samples, doesn't that negatively impact service delivery? So I think we can leave the teams to respond to the questions as we think of others, okay? So Tanzania, I think we have had many questions. Hello?
Hello.
Yes, good.
First of all, I think the question of SMS is more likely go to Kenya. We have not started using the form of SMS for sending results in viral load. On the issue of SRS, the SRS is a web-based system that was designed by local developers here. What it actually does is we install a system in the hub level where all the samples for viral load have been registered. And this system sends information to the national repository. It's an open LDR where all the client's information are stored in. And when they're stored in, the hub sends printouts barcodes or a manifest of all the samples they've registered. And they send the samples together with those manifests. When they reach the laboratory, there is an interface computer which is installed connecting the SRS application with the testing laboratory LIS system. Now, what we do is when the samples have arrived, we scan the barcodes which came with the sample, and then you accept them. When you do the acceptance, the LIS absorbs the information from the national repository and saves it in the laboratory lab information system. And then you can go on processing the sample. The same way is also used when you authorize the results. They go through the interface and go back to the same route that they come from, meaning the results will go back to the national repository where the missing information apart from that where the hub had registered, now the testing laboratory will just add the information of results. And then that information will also flow back to the hub, to the hubs, where they will be able to print the results of those test samples which are done, and then they collect them per facility and send them back to the facility that actually provided those samples. That's my answer for that question.
Okay. Hello? So you seem to be muted. Yeah. Tanzania, are you done? Before we call in Kenya. We are not hearing you.
I was asking, should I give more room for discussion on this question of
Hello?
SRS, or can I go on to the rest of it? Hello, can you hear me?
Yes, now we hear you. Yeah. Okay. Okay.
I was asking.
So the question
Yes.
is whether we should allow more time to discuss this. Okay. So you said. Okay. Okay. So unless the members want to dig in deeper, but we may not be able to resolve most of the details. But of course, that gives us incentive to learn more, to reach out more to you so that we can learn. This is the essence of this network. So we see a best practice, and then we try to see how the rest of us can learn from it. So unless somebody has something very burning connected to that SRS system, I would want to bring that to a close. This is just like an appetizer, so that you gain more interest to reach out to Tanzania for more help. But we will continue to follow up. Is there anybody who has something burning regarding the ACRS? So I think I will call in Nancy. I saw your hand. Nancy, I saw your hand up. You can unmute. Unmute yourself, okay?
Yes. Thank you, Charles. I wanted to respond to 3 questions for Kenya, and maybe one of my colleagues, ICT Mike, is around, will respond on the SMS printer. I mean the SMS notification. But I will wish to respond to question from Pascal asking what do we do with what do the hub does. I think in my presentation I said they are able to do corrective action in terms of sample rejection, and they offer supervision again. From the national, we are able to train up to the hub level by getting focal persons in terms of viral load EID, and the county implementing partner supports them now to do the support supervision to the spoke facilities so that they troubleshoot whatever is coming from down in case of samples, referral, sample storage, and on-job training. So we are supporting it from the national to the up to the hub. The hub is supported by the implementing partners downwards in terms of supervision and mentorship down. And in terms of coordination, we do, we coordinate, we have a national technical working group which coordinates the 8 testing lab. So we are able, and those in the map again, you could see that the country is mapped in a way that each lab is networked to some counties. So there's no crisscrossing of samples coming from another county if you are not networked to that lab. And also the partners are again mapped within each county. The county implementing partners are mapped according to each county. And we could also, and also the hubs are mapped again within each county. So you're able to tell that this hub is within this county, and this hub serves which facilities within the county. So in terms of supporting the hubs, there are specific implementing partners which care and treatment implementing partners which supports sample transportation within each county. In terms of SMS printer, the ICT person can tell you the connectivity, how. If Mike is there, he can respond. But I know the clinician is able to receive information on our patient without the name of the patient is not there, but the ID of the patient is inside. So confidentiality is broken from there, and that you cannot really go with patient samples, name. And the patient is only able to receive only the notification on come back to the facility for your results have come, or either congratulations, your viral load is suppressed. I don't know if Mike is in or Ken, whosoever, my Kenyan team can respond to that.
Yeah, I think as Nancy has just told you, most of the communication actually on the SMS is between the testing labs and the actual hubs. So they started out with SMS printers, where the patient numbers and the results, the viral results, would actually come out, usually targeting people with very high viral load that need attention, like critical attention. Individually going to the clinicians, we're still trying to partner with mHealth to see how that is done. And as you raised, as some of you have raised there, it actually presents some confidentiality challenge. So yeah, together with some of our partners, that's still in discussion, because we realize it's still a sensitive area. But yeah, most of the communication will be between the testing lab and the hubs themselves in terms of SMS. So I think that's pretty much it.
Okay.
Thank you, Mike.
Yeah, we still can pose a few more questions. We have about 4 minutes to pose a little more questions. If anyone out there wants to ask a question. Yes, Pasco, you can unmute.
Yes. So I have a question for the Kenyan team. So I think I read that the people living with HIV are somewhat, engaged or involved in the sample transportation. So it looks like an excellent idea, and I just want to know from the Kenyan team how they manage to motivate people living with HIV to transport the sample, and whether or not other people from the civil society could play that role and increase the efficiency of the sample transport.
Okay. I think what I can respond myself is, I think they play a role in terms of being part of the network. Technical working group who talks on how. And in terms of support of transportation, I don't know, in terms of not physically themselves transporting, but they play a role in contributing to what is the best way of transporting samples. That's what I can say. Unless any of my colleagues can share something.
Okay.
Ken, are you there? Or yeah, Mike.
Yeah, I remember when also the hub and spoke model would start, is that the group, rather the institution, people living with HIV, they're very influential in the community. So, and we needed people to access the nearest facility instead of going to the hubs or the testing labs directly. So they greatly influence the patients to reach out to the nearest health center instead of reaching out to the bigger hospitals to maintain a more efficient network. That was from the earliest time when the model was actually being introduced.
Okay, there was also a question I posed, I think largely to Tanzania. why, okay, they are using health workers to also move samples. And I was asking what impact is that having on the service delivery. Then Kenya, you have several ways to move your samples. So you have the motorbikes, and then you have the SGS, and then you have the partners. So in terms of cost and cost effectiveness, why would you have different approaches? You have a private courier, G4S. Then you have motorbike riders. Then you have partners. Why would you have, and in cost effectiveness, how do you marry the three into something more robust, well coordinated for the country, and more cost effective?
I can start as Kenya, maybe if the other colleagues will contribute. In terms of the three models, I mentioned again that these three models depends on the best fit to the facility. If the facility is far to reach areas where the courier services, because G4S really are mostly in urban areas or where the vehicles can reach. So for facilities which are not able to cannot reach the courier site, that is where the partners now supports using their own vehicles or use of motorbikes come in at that moment. And again, for the facilities which are near to the testing facility, it is cheaper to use that direct transportation of samples using a motorbike to the testing facility than to wait again for courier services as a national, because if you transport each and each one in courier, you package it singly in the national courier services. So for cost effectivity, you better riders if you can package them as a bulk within near to reach testing facility.
Okay,
I think that's what
so
we can say.
just 1 minute to Tanzania to respond before we give some announcements.
Maybe. Thank you very much.
Yeah.
Okay, go ahead, man. Okay, I just wanted to respond. Maybe my colleagues will also chip in a few minutes. In the use of healthcare workers, we used to do in the early introduction of this hub and spoke model, but we no longer do that. I think the presentation, maybe it was not very clear, is that we are also like Kenya. Sometimes we use HIV patient, the peers, which are readily available at the clinic. They help with a lot of other duties at the clinic, including tracking some of the patient in the community. So currently, as we said, we use the border, the motor riders between facility to hub, and then from hubs to testing labs, we use courier systems and the other partner models. But for sustainability, I think we are going for the courier system so that we can standardize our way of transporting specimens. Maybe my colleagues, if they want to add, they can do that.
Okay, because we are also running out of time, we can bring the discussion to a close. I have a few announcements. This is quite informative, and thank you to Kenya and Tanzania for sharing your experience. And we'll keep reaching out to see that we can learn more on what you've been able to achieve. But moving forward, we really need to look, because I saw most of your challenges around funding. We need to find a more cost-effective way and to have unified system which the country can buy in and ride on in a more cost-effective way, unlike having a system entirely dependent on partners like Tanzania, where almost every region is having their own piece, like the city Dar es Salaam, then the Southern Hills, where they have courier freeze vehicles, and then other places that have got different things. I think we really need to work around unifying a system which is cost-effective and easy to coordinate and sustain. So we will continue to reach out. We are particularly going to be reaching out. This subject of sample transport is a detailed one, which we may not be able to finalize in a session of 1 hour. So we'll be reaching out to you for more help, for more information to guide the countries. And we are going to be reaching out to countries specifically and address their challenges, discuss them specifically, and come up with corrective actions. So when you get our phone calls, please understand we are following up to see that we get something that suits best for a given situation, because there may be no one fit for all. Then we are going to start, we are also planning to have a face-to-face meeting where we are going to call all of you together in one workshop, and then we discuss things for a few days. You'll be getting more communication about this plan, and I hope it will energize us and it will help us to interface face-to-face and create more bonding. Then we are going to be sending out a checklist to understand how you're working and what your viral load cascade looks like, and what gaps are there and what best practices you have, so that we can document and be able to know which country is going to teach what. Then the next topic of our discussion. Today we touched on the hub and spoke. It's not thoroughly done, but we are going to be reaching out throughout this month, reaching out country by country, and we are going to be making phone calls, and we are going to be having specific Zoom meetings for country teams alone and discuss things in detail. So our next topic, we had earlier discussed to have lab optimization in the previous discussion, but because there were so many unanswered questions about hub and spoke, we decided to come back to it. But we want to know, what do members want us to have for our next discussion? We had the other time agreed on lab optimization. How can we make our labs optimal? Working optimally so that they don't become white elephants, they are not using suboptimally, and they become very expensive for us. So connecting that with sample transport. But I don't know whether there's a change of heart that you'd want to discuss something else, or that we'll do for our next discussion.
Well, I think, Charles, if I may step in, so I think it will be a great opportunity when you follow up with individual countries, just to kind of have an overview of what potential topics the countries would like. Maybe we'll do that next week. I mean, in the next coming days, very rapidly, and we can come up with a consensus topic for the next call, which will be in the follow-up of the sample transport, or maybe another topic that you find very interesting, and then we just move on.
Okay, thank you. Thank you for that guidance. So as we wind up, we encourage you to register yourselves on Slack. We continue to deposit material there, and even these presentations, you'll find them there. But please, many of you, we have sent you invite, but you are not yet going there to register. Can you please register yourself when you get these invites that we give you? So for now, I would want us to pause at this point. There's still a lot to catch up with, but we are going to be following you in the coming days to discuss things in details. Thank you very much for making time for this very interesting discussion we have had. And please let us continue the discussion on Slack. Go and register on Slack. Thank you very much. So that ends our discussion today.
Thank you.
Thank you, Charles. Charles, Welcome.
Have a nice evening. Thank you. Thank you.